Healthcare and senior care is fraught with problems and challenges, but we're also seeing some amazing new clinical treatments and resources. This show will help illuminate and uncover the good, bad, the ugly in order to equip patients, families, and other healthcare providers. Welcome to Senior Care Confidential.
Hello there, Brian. It is so good to see you today, and we have a great show in store.
Yes.
We have a special guest, Allison Bird Haley, who sells Medicare insurance and benefits to seniors. October 15th is right around the corner, and people that are signing up for plans, supplemental insurance, Medicare, now is the time to know what you're doing and know what you're signing up for. Brian, you are a healthcare provider. You are on a different end of this Medicare program. And so you're the one that you hear the authorization. Patient A gets 4 visits. Patient B gets 6 visits. A lot depends on what plan they're on.
Yes.
So we're going to ask questions. Allison, Brian, I both have known you for a long time. You're very respected in the industry, and we just appreciate you being here. So we're going to show a little clip of very famous football player, Joe Namath, who was very popular when I was a little bitty girl. So we're
you'll see this commercial like every third commercial coming up because it's open enrollment season.
And what's real interesting, it looks like a Medicare. It looks like a government
red, white, and blue. It's very patriotic.
So if we can roll that.
Attention. The Centers for Medicare and Medicaid Services has officially authorized new benefits that Medicare Advantage plans may include. To get the benefits you deserve, you can call the Medicare Coverage Helpline.
Hi, I'm Joe Namath. If you're on Medicare, this is important information. I called the Medicare Coverage Helpline and they instantly looked up my coverage. In this one simple call, they offered to enroll me in a plan that includes rides to medical appointments, private home aides, doctors and nurses' visits by telephone, and even home-delivered meals. The plan also includes dental, vision, hearing, and prescription drug coverage, all at no additional cost.
Don't delay. Call to see if the new benefits are available in your area.
Call the number on your screen now. It's free.
Call 1-800-404-9700. That's 1-800-404-9700 now.
Okay, so what did you guys think about that commercial?
Well, I mean, obviously everyone knows him. He's a famous football player. I mean, I think people are like, oh my God, if Joe's could do it, I'm going to do it. And so, I think it's all about educating somebody. Yeah. What are your thoughts?
I think it's smart marketing. You got somebody who's trusted that everybody grew up watching. You've got the whole red, white, and blue patriotic theme. Mm-hmm. You've got some suggestion that it's connected to Medicare. So it's like, I forget what it was, like 1-800-Medicares.com or something like that, where it kind of seems like it's a governmental official thing. So we were talking before the show that Medicare has actually changed the rules on some of these, because it used to be like every third commercial, it seemed like, was one of these Medicare Advantage plans. So what are the new rules with these now?
So, I mean, you'll see some advertisement, hey, time for open enrollment, but you're not going to see it every third commercial. They're going to limit that because they want to make sure that there's more compliance. They want to make sure we're not steering people by just, seeing it on the screen.
Yeah,
Well, it's kind of like buying Taylor Swift tickets.
Yes.
Who gets that spot first?
Yes.
What do they have to pay to get that spot?
Right.
I mean, is that really fair? Is that a fair distribution of the companies offering this insurance?
Absolutely. I think you'll see more of the carriers, that will be advertising.
I know that CMS, so CMS, for those that are listening, is Centers for Medicare and Medicaid Services. And so they were looking into these things because there's been complaints, right? This has been happening for a few years. It's gotten worse over the last couple of years, but there's been some complaints on some of the misleading commercials. And the commercials, honestly, for the insurance folks that I know, like you included, like when they see the commercials, a lot of them will cringe because like, oh my gosh, like this is bad. And so CMS actually found that 1 out of 4 commercials are actually fraudulent or misleading in nature. And so that's probably what's leading towards, hey, we're just going to nix quite a bit of these things so that we can help.
And another thing with the New York Times, they reported that 8 out of 10 insurance companies overbilled Medicare. And I'm seeing as a care manager, every one of my patients is over 65. And if they are in the hospital, they are getting every test under the sun done, whether they need it or not. But nobody's communicating. So it's really frustrating. Yesterday, and Allison, I have recommended you to several of my clients, and I appreciate you so much. And I love that you answer the phone and you answer questions, and I appreciate you. But while I was there and we called from their home to call you, they got on their landline probably 5 calls on insurance and Medicare Advantage plans. And I thought they're not supposed to solicit calls.
You have to be on a no-call list, but I mean, that's the thing. These seniors get calls all the time, and it's from people that probably are not here locally.
It's a call center someplace.
Well, and one the other day, this family, this couple that I was with, they got a call saying that it was their grandson calling. He said, "This is your grandson, and I'm really in trouble." And this is not my grandson. They caught it. But imagine those people that are very lonely, or they haven't talked to their grandson in years, or, they are just such victims and, so susceptible to scams.
Right. And see, that my thing is, I don't want anybody to have that issue. Yeah. I mean, my mother-in-law called me and she's like, "Hey, I'm going to sign up for this plan." I'm like, no, don't do anything. I can help you. She's like, "Oh, it seems really easy just to call." I'm like, "No, I'll help." But then my dad, he was in Florida, moved here 6 months ago. And I've talked to him about his insurance. He's like, "I got a supplemental, blah, blah, cool." My dad's very, sound mind. Well, no, he had an Advantage plan. And I didn't realize it. And he's like, I was like, "We're going to have to switch you." And he's like, "I thought I had this." And so, he just thought he had this and it was that. So it's like, me as an agent, I want to educate. I want people to feel comfortable. So, honestly, coming in their home makes them feel a lot comfortable. And we'll say, let me show you black and white on the screen what is beneficial for you. This is what A is. This is what option B is.
So that's helps. a great way.
And what I've found is that Medicare Advantage plans can work. A 2021 study in the Journal of American Medical Association found that Advantage enrollees often receive more preventive care. So that is for those that are super healthy. I have some 98-year-old clients that are doing great. So to me, it seems like that they would let these potential customers know that if you're healthy, these Advantage plans are really beneficial. If you're not healthy, these are some other things I recommend.
Yeah, they're kind of trade off. So this is we've got open enrollment starting October 15th, so like 3 weeks from now. So for those uninitiated or those that are just kind of confused because they see all the ads, can you explain the difference between what is open enrollment? What's A, B, C, D? There's like a Z plan or a G plan. So what exactly, how does that all pan out?
Okay. So open enrollment is basically your time of the year. You can change plans if you want. Everyone, that is aging in, obviously the open enrollment is at that time.
Okay, so define that. They have to be 65. What if they're 64 and they turn 65 on January 1st?
So you can enroll 3 months prior to them.
Okay, 3 months prior. Okay, so 65, 3 months
But some people are on disability, so they're on Medicare already. And they could be 61, 62.
You can do open enrollment anytime, but the annual open enrollment it starts on October 15th.
Correct.
Yeah.
Correct.
Okay.
So A is your hospitalization.
Okay.
And that's 80% Medicare covers.
Got it.
Okay.
So that really has nothing to do with the Advantage plans.
No, nothing. Okay. And then you have Part B.
Yep.
So that you pay, usually,
that's your monthly premium.
Yeah, it's your monthly premium. So you pay for that, and that is your doctor's visits.
Okay.
And it can be visiting physicians.
Yeah, absolutely.
Right.
Absolutely.
And hospice, is that Part B also?
So hospice would, yes.
Okay, what about Medicare Home Health?
That's A.
That's A.
Yeah. Outpatient therapy would be considered B. Anything institutional or home health. So if you were at a hospital, a rehab facility, or skilled nursing facility, or home health, that's paid under Part A.
Okay, that's good to know.
Yes.
And see, I don't know that.
Right.
So that's very good to know.
Right. And then people get Part D because they need their drug coverage.
That's right. Yeah.
Okay. And then people are like, okay, well, I'm only getting 80%. What if something happens? You would my 20% hospitalization.
Yes.
So then people some people have a plan F. Now that's gone away. Now
Yep.
it's Plan G. That's their supplemental. That's a monthly, fee. And that could be from $110 to $200. That varies.
Yeah.
Some people are like, okay, I don't want any of those letters. I don't want to do any of that. I don't have the extra for supplemental. And that's where the Advantage comes in. And that's a Plan C.
Which includes B and D. Is that right?
Yeah. So you get
So it
your
includes the
doctors, your
outpatient
hospital,
stuff. Yeah.
and then you get your pharmacy. But then also I think people see I'm going to get dental, I'm going to get vision, I'm going to get these extra benefits.
My dog walking.
I get
Yeah.
medication.
And that's
Yeah.
appealing, obviously.
Right. Yeah. They're trading off some of the lesser cost stuff while restricting for some of the higher cost stuff.
Right.
And so one of the questions, in fact, we were talking earlier, I have 3 calls just in the last 2 days that of family members who are trying to get on service with us, and they wanted me to run insurance. And they were surprised that mom or dad, there's 3 of them now, that mom or dad they swore up and down they were on Medicare with a supplement. And even the kids thought that they had put them on this plan and ended up being an Advantage plan. So to remove I wish they would just retitle the Medicare Advantage to something different that didn't have anything to do with Medicare, because it creates confusion, because everyone thinks that they're staying on their Medicare and they're getting these goodies on top of. It's not. You're actually replacing it. So is it, to avoid this confusion, would it be successful, I guess, if they asked, hey, if I take this plan, so if somebody's trying to sell them on a Medicare Advantage plan, if they ask, do I still have Medicare A? Is that a way to kind of ferret out some of the confusion, or would they still say, yes, you have A, but technically it's under
But
C?
they're not going to think
No.
to ask that.
That
No.
would,
I mean,
so
How do you make sure you're staying on traditional Medicare? Because these people, the daughters I talked to, were
Right.
both pretty savvy, and they're like, no, they're on Medicare with a supplement because I made sure of it, and I'm like, they're not.
Right.
So even they, knowing what to look for,
Right.
got duped into something. And I say duped because they in their words, they were educated enough to let the broker know, hey, this is what we want to keep mom and dad on, and it didn't happen.
right.
So how do you avoid that?
So I avoid it. I mean, when I'm educating somebody, I show them something. I was
Okay.
like, okay, this is what changes when this goes to this. And it does basically say you have Plan C, and Plan C is what you got, and that's it.
Okay.
No A, no B, no D, no G.
If your card shows an HMO or a PPO plan, is it considered a Medicare Advantage plan?
Yes.
If your card is a supplement card, like a Humana supplement card, would that have any HMO, PPO on there?
No.
Or would it say supplement?
Say supplement.
So maybe that's what it is. Maybe they
Yeah.
need to see what the card looks like.
Right.
If there's HMO
So-
or PPO, you know you're in an Advantage plan.
Yes.
If it says supplement on the Humana card, or I'm picking on a Humana, but on the Blue Cross Blue Shield card or whatever that is,
Right.
then that's a way to determine, hey, I'm
Right.
actually on original Medicare with a supplement.
And it's funny you mentioned that because
Yeah.
people do call me and say, I need your help. I'm like, what do you have? And they're like, I said, just get out the card
Yeah.
and it will tell me. And if they say HMO, then I know what they got.
Yeah. They are on an
Yeah.
Advantage
Yeah,
plan.
and I know this client that you're going to be meeting with has something through AARP, and he needs to see a neurologist, and he can't. There are no neurologist on his plan, and that is AARP. So he needs neurologist. You know, so what do you do? What if we've done the steps. We know in October he wants to change. How does someone ask the broker like you, if I need a specialist? How do I know that the specialists that are good and, just high ranking, how do I know that I'm going to get the right specialist when I need those specialists?
When I, meet with somebody, I ask them who your doctors are. We got to make sure the doctor takes the plan. With a Medicare
Do you
person,
check that?
Yes. With
Okay,
Medicare,
do most
Medicare's
people
Medicare.
check
They
that?
take Medicare.
This is why we're interviewing a broker and not one of these call centers that have the Medicare's 800 number.
Yes.
Because they're not checking
Yeah,
that.
but I
checking
check
that
everyone's
stuff.
doctor.
They just
and
want you to switch over
Right.
regardless. Yeah. So
I
there's
check
the
their
benefits.
Because they get a
medications.
commission.
Right.
Right, and
Yeah.
I check their medications.
Yeah.
Is your medication going to be covered on this one or this one?
Yeah.
Ideal.
But the commercial, Joe Namath says it covers vision, medication, dentist.
You didn't see the
Sure.
fine print at the bottom that
Right.
it's subject to plan,
it's specific,
right?
you have to be
And,
very
it's
specific.
subject to authorizations. That's where on the provider side, that's what we see. So remember we were talking about the Part A piece is where that part gets replaced by the Medicare Advantage plan. And so when you're talking with institutional facilities and home health, we all bill Part A, where we get a lot of the pushback from. It's not pushback; it's just confusing questions from our patients, family members. It's like, wait a minute. I was told I had this Medicare Advantage plan and that they cover, and they'll flat out send me emails like, here's the chapter and verse where it says it covers everything that Medicare covers. I know that's what they say, but then there's an authorization department, with some lady sitting 1,000 miles away who's going to look at all of our notes and go, yep, I'm going to authorize 3 visits versus, the 18 that you wanted. Or at a skilled nursing facility, they're looking for 18 to 19 days and they're getting 6, right? It's because they're still technically covering it, but you're going to go through an authorization process of somebody else who's going to figure out
a way to say no.
Right.
That is so sad. And our seniors that have worked so hard and worked in the
some
system.
of their defenses, though, there are some, and I'll avoid getting into like company specifics, but there are some plans, usually they're the PPO type plans, that have a wider network of people to go see, and they are far less restricted. And also, I'll tell you, UHC for several of their plans are actually far less restricted. If you're going to go Medicare Advantage, like here in the Dallas area, I'll tell you, those are some of the easier ones for me to work with. Some of the other ones, not so much. But there are several plans under the UHC umbrella where they're easy to work with. There's really no pre-authorization process.
You don't need a referral to go see a specialist on PPOs.
They'll call me and ask me, or they'll send me a fax going, hey, can you send over your documentation stuff just so we can kind of QA it or whatever. But they're not relying on that to give me access to go, hey, we're only going to give you 6 visits. So there are some plans like those that don't have that. But the vast majority that we work with do have those.
So tell me, what is the difference? So I remember in my VITAS days, because I've been working private pay for years now, but we used to always collect the Medicare card, make a copy of the Medicare card, and we'd also make a copy of their supplemental insurance. Mm-hmm. And I would always say that has nothing to do with your hospice. Your hospice benefit is paid for by Medicare. And they had that supplement. And so why the switch to all these advantage plans when wasn't the supplement with regular Medicare working better?
It depends on who you talk to. So this started like 20 years ago, right? To like now, I think it was in 2003 when they started adding, back then they were called like a Medicare replacement plan, and they couldn't sell enough of them because nobody wants a Medicare replace. So now we call it Medicare Advantage. So that's a marketing. They're really good at marketing. We'll give them that. Mm-hmm. I should hire them. And so they're now called Medicare Advantage plans, but the initial idea of it was, you have the silver tsunami. We have all these people who are retiring, and there's not a big enough generation coming behind to kind of help offset. Costs of Medicare, medical costs are going up, and so something's going to have to give. We're going to have to figure out a way to be either more efficient with our Medicare dollars, or we may have to increase payroll taxes. And so this was a design to, in theory, the insurance companies are the experts in the room, right? Medicare is just they're just bureaucrats, in Washington, D.C. They've never run an insurance company before. And so the idea was, well, maybe if we involve the private sector, we can figure out some cost efficiencies and see if there's ways to make the care more effective for fewer dollars. And so I was actually a big fan of them initially because that was the design. Like, yeah, everybody, like, I'm paying payroll taxes, you're paying payroll taxes. Mm-hmm. I want that money to be there when I retire. And so I think initially that was successful. And then unfortunately, I don't know what's happened over the last few years. I've just seen a lot more on the restriction side of it. And you're seeing a lot more of these, I'm hearing a lot more complaints from family members. It feels like it's weekly now. And then you're also seeing these reports, like the New York Times are reporting things about, 8 out of 10 of them are billing fraudulently. You find that, I think it was Kaiser reported that the Medicare Advantage plans overbilled Medicare by anywhere from 12 to 20 billion last year. Mm-hmm. And so like now depending on the study.
So where's that money going?
CEOs and lobbyists. Oh, and so that's the other thing too. There's a guy by the name of Wendell Potter, Wendell Potter. He's a former executive within, I think he worked for Cigna and Humana. And so he's posted a whole bunch of stuff and he's been interviewed all over the place. And so he's kind of leading the charge for some regulatory changes within the Medicare Advantage world. And, he's shared a bunch of stuff, and part of it, what he's shared is there's a thing called regulatory capture, where essentially the folks who work within Medicare, who regulates the Medicare Advantage plans and the insurances that are the Medicare Advantage plans, there's just kind of these revolving doors where they all kind of work for each other, and then the lobbying dollars go to the congressman, and every year you get 400 congressmen who write a letter extolling the virtues of Medicare Advantage, which, by the way, they don't do that for anything else. We can't get them to do that for homeless or for, women's shelters, but they'll damn sure do that for Medicare Advantage. And so he's kind of anti them because he sees all this stuff. I'm not necessarily anti them. I think the design, the intention of the design was good. I think it's just become it's been abused over the last few years. And like I said, there are still some plans that I like to work with. But they're a minority of the plans.
So the ideal customer for the Advantage plan, from what you're saying, is really the healthier senior.
Yes.
So let's give an example.
Or someone that cannot financially afford the supplemental. Because that's a lot.
Yeah, that makes sense.
Out there that
so
will
then
say that.
Somebody, let's say he has had cardiac problems for years.
Mm-hmm.
He's 70. He's already had a couple of cardiac surgeries. Let's say he's just turning 65. Okay. So he's had some cardiac surgeries, but he's trying to stay as healthy as possible. He's taking his meds, seeing his doctor regularly.
Mm-hmm.
What would you recommend to this new to 65, new to the Medicare world? What would you recommend for him?
So, I can't recommend,
Right.
I can present.
Yeah.
Let me present this and let me present this. And then what questions do you have? So, because I can't induce them to do this,
Right.
you know?
Her job is really, which is why I appreciate working with brokers,
Yes.
because their job is really, hey, here's the educational, here's what this plan looks like, here's what this plan looks like, here's these options. The trade-offs are X, Y, and Z, and you got to, as a consumer, you got to pick which one you feel like is going to be better for you.
Right.
And so one of the things that a lot of people aren't aware of, the trade-offs, while there might be a lesser premium every month, like you're still paying, if I'm not mistaken, they're still paying Part B no matter what,
Yes,
right?
they play unless they get credit so they can.
Right, which
yes.
happens in very small cases, yeah.
Sure.
And so, if you go with like a Medicare, original Medicare plan with a supplement plan, and then you got to get up a Part D most of the time because there's medications involved.
Right.
You're probably looking at somewhere between like $110 to $135 extra a month to have that over what you would get with what you would pay for a Medicare Advantage plan. Okay, great. Saves me whatever. Was that $1,300 a year? But one hospitalization with the copays and the coinsurances wipes out that completely. And so that's one of those things where if I'm healthy and I'm pretty sure I don't really need care, that might be a way to go if you want to save $1,300 a month. For me, I like to have a lot of insurance. And so I would much rather have the wider network and know my fixed cost is $130 a month versus if you're on a Medicare Advantage plan, correct me if I'm wrong, you don't really know what your fixed costs are because there may be coinsurances or copays that, depending on what's going on with you, specialists that you need to see or whatever, I don't know what that looks like from month to month. But for some people, they may choose that option. It still works well for them. And other people may choose to go with original Medicare with a supplement.
Okay, so I've got a customer. You get the call that it's a husband and wife. They went with an Advantage plan.
Mm-hmm.
They're not getting good care.
Mm-hmm.
How do you handle that when you go in?
So they can maybe move to a supplemental plan, but they'll be underwritten. You're not.
What does that mean? Maybe.
The only time they're not underwritten is if they just turned 65 or they've been on it, let's say, 4 months, and they're like,
So
I don't
if
like
you-
this Advantage plan, then we can, move them, and they're not underwritten.
So is it a myth or fact that once you go on an Advantage plan, you really can't get off?
That is a myth. I mean, you will be underwritten, and that may hurt you.
And what does that mean?
Basically, they'll pull all your medical history.
So, for
And
example,
they may say,
yeah.
hey, you know what? It would have been 150. Now it's going to be 450.
That's
and
right.
a lot of people
That's
are
right.
like, can't do
So
that.
what'll happen is if you go on, so your scenario before where, okay, I'm perfectly healthy. I golf 3 days a week. I don't really need to spend the extra $1,300 a month or a year for Medicare with a supplement. I'd rather go golf, right? And spend that money towards golf because I'm healthy. Like I don't take any medications. I worked with a patient not too long ago who had something as simple as hypertension, high blood pressure. And because of that, he could not get underwritten for a supplement plan. So the danger you run into is once you're on the Medicare Advantage
For high
plan.
blood pressure, which how
Right.
many Americans
I know,
over
right?
65?
So the danger is you can be locked in. It's not that you're locked in the Medicare Advantage plan. It's that the supplemental plans won't guarantee issue for you.
So
you could
when-
always go back to original Medicare, but then you're going to be stuck with the 20%.
So when
out
these
of pocket.
people are making these sales over the phone, are they explaining this to these sweet little vulnerable seniors?
I would hope so, but I don't know.
Right.
And that's the thing.
That's why you go through a broker.
You go through a broker.
I know, but
Yes.
it seems like that
Yeah.
telemarketing should be, scrutiny, that's not right.
Yeah.
I'm just looking out for seniors.
That's right.
No, absolutely.
This has been really good information. Thank you so much. So
you, Brian.
we both agree, and I think you do too. Like the commercials and the mailers and all that kind of stuff, it just creates a lot of confusion. And the call centers really are not. They don't have the best. They're not looking out for the best interests of the seniors or the family members. So if we have audience members who want to contact you, what's the best way to reach you?
They can call me. My number is 469-260-4716.
Okay, perfect. Okay.
That's awesome.
Yeah, highly recommend going through a broker.
Right.
This is such a confusing process. There's so many A, B, C, D. It's an alphabet soup of plans.
Absolutely.
And you need someone who you can trust, who we trust, to make sure that they go
call
through.
in. They're never going to speak to that person again. For me, I'm going to be the broker for life.
That's right.
Yeah.
That's right.
Yes, and you do a great job.
Thanks.
And Sunday, you two are going to be guests at First Baptist Dallas
We
downtown for a Sunday night class
Lively
on
class.
insurance, Medicare, home health. And that is going to be super exciting. So if people want to come, it's at First Baptist Dallas downtown on Worth Street at 5:30 to 7. It's going to be fantastic.
Yeah,
and
looking forward
then
to it.
we've got a healthcare fair coming up also this Thursday at First Dallas, which is going to be neat. Y'all will have some information there. There'll be a lot of people there. So, just if you have any questions regarding healthcare or home health or hospice, please call one of us. Brian, what's your phone number?
321-271-4052.
And I'm 214-415-3779. We always want to help you. And if I don't have the answer or Brian doesn't have the answer, we will find somebody that does.
That's right.
So we want you to have the very best coverage out there.
Right. And y'all do great in the community.
Thank you.
Which is a blessing.
Thank you.
All right.
Thank
Well,
you
thanks
so
for
much.
coming on the show,
Thank
Allison.
you,
Really
both of
appreciate
you.
you.
Yes, it was awesome. Appreciate you.
Thanks.
Bye.